and our partners in this, media partners in this, collaborating with us are United News of India, UNI Television, also Network 18 and PIO TV, and of course the national network Doordarshan. So this is a very important occasion. That's why we decided to have a blended hybrid press conference, which is both physical and virtual. You probably can see on the screen three very large blue beautiful boxes that we'll talk about later. But the most important thing is that we are here to welcome B Medical Systems from Luxembourg, and the press conference today is about how India is gearing up for COVID-19 vaccine. I wouldn't get into the details, but let me just introduce the subject and our friends here and let them talk about it. So it gives me great pride to welcome Luke Provost, Luke, welcome, and Jaisal Doshi, and from B Medical Systems, which is Luxembourg, and Nimish Parekh on my far left from Parekh Integrated Services. We are proud. It gives us a lot of pride because Luke and Jaisal have flown in all the way from Luxembourg 2 weeks ago in these COVID times and fearlessly traveled across the country with a mission to help India fight COVID-19. People believe that a vaccine is the end of COVID-19. That's not true. When a vaccine comes, most importantly, how do you store it? How do you get it to the far-flung areas? How do you make sure that it remains as efficacious as it's supposed to be, so that when the dose is given, it does the right thing to you? And so they are here with that mission, and the reality is that vaccine will start the story of distribution and vaccinating the country. And India is going to gear up with companies like B Medical Systems. Getting this highly temperature sensitive vaccine to every corner of the country, to every Indian, is going to be a Herculean task for the government. So the government is reaching out to everybody across the world and in India who can help them accomplish this task. And that's where B Medical System comes in. It's a company that's formerly known as Electrolux. And B Medical Systems is the global leader now for more than 4 decades in providing storage and transportation solutions to more than 140 countries around the world. And now they're here very much in India. So without much ado, I'll hand it over to Luke and Jaisal and let them talk about this exciting mission of how you're going to help us fight COVID-19. Thank you.
Thank you very much. Thank you. So first of all, good evening everybody. Namaste. It gives us really great pleasure to be here after traveling 2 weeks around India. And we started our trip actually in Delhi and have since then visited Hyderabad, Mumbai, Ahmedabad and other parts of Gujarat before coming back to Delhi. It's really surprising, but just a month ago we were not even aware of this happening. And it is only on the 19th of November when the Prime Minister Modi and Prime Minister Bettel had their virtual summit, and where Prime Minister Bettel proposed to Prime Minister Modi the support of B Medical Systems, who has been the market leader since 4 decades in the human cold chain and against the fight of COVID around the world. It's a testament to the strong cooperation between the two governments of India and Luxembourg that less than a month later, our team is here present to announce proudly the manufacturing of our products and solutions in India for the Indian market, and that we will be starting our rollout as soon as early February, a month ahead of the target that was given to us. A large part of this success is thanks to my colleague and friend Jaisal Doshi, who will be the CEO of our Indian operations. Before we share more details of our plans, I would like to thank Prime Minister Modi for his visionary leadership in helping make this happen, as well as Prime Minister Bettel for the unwavering support he has shown to our company. I would also like to thank the Honourable Minister of External Affairs, S. Jaishankar, the Honourable Ambassador of India to Belgium, Luxembourg and the EU, Santosh Jha, the Honourable Ambassador of Luxembourg to India, Jean-Claude Koubner, and the Joint Secretary of the Ministry of External Affairs, Sandeep Chakraborty, for their support and guidance throughout the entire adventure which has just started. During this trip, we visited and met with several visionaries from across state and central governments, as well as leading private companies. We met with more than 100 people across the country, and it has left me with no doubt that India will achieve its target of a $5 trillion economy by 2024 under the visionary leadership of Shri Narendra Modi. Now, we are approaching year-end, and I would like to take this opportunity to wish you and your families a safe and happy year-end, but also that Beam Medical Systems may contribute to the COVID fight and to achieve our vision, which is to help vaccinate more than half of humanity. We would now like to provide you an update about the progress that we have made in the last 2 weeks and our plans, what you can expect from us in the next few weeks and months. But before that, I would like to share with you a small video giving you a glimpse of our technology and the technology transfer that we will bring to India. Thank you.
Dans toute votre chaîne logistique, tous ces efforts qui ont été faits en amont peuvent être très rapidement perdus. Et c'est pour ça que la chaîne logistique est très très importante à tout niveau.
You need to refill it with dry ice for another 5 days, but that is a huge logistical challenge. Also because the quality and density dry ice that you need is extremely difficult and not possible to get everywhere.
In Philadelphia, we watched the city's 2 ultra-cold freezers begin to cool down. Before they can store up to 320,000 doses of Pfizer's vaccine, they'll need to get to nearly 100 degrees below zero.
Colder than Antarctica in wintertime, basically, is a good way to think of it.
The CDC and Philadelphia Department of Health gave us an exclusive look at the city's brand new ultra-cold medical freezers. Matt Tallman sells them. His company is one of the 5 major ultra-cold medical freezer makers in the world.
As you can see, our factory is really top-notch modern technology in Luxembourg. And actually this technology is not alone the heart of our system. We have really good quality products which have proven their efficacy in remote areas of the world, all over Africa, in Brazil, in all over the harsh areas that you can see around the world. And here on the screen you can see a live demo of our remote temperature monitoring system. This is also very important because it is not only important to have good quality products, it is also very important to have monitoring to be sure that all the equipment that you have installed throughout the country works perfectly well. And our remote temperature monitoring systems allows exactly to do that. Here you see an install base of our products around the world, and you see all the green dots represent every single one as a product around the world. And if we click on one of the units to see how this works, it will give also the details of that unit that is working in that location. And I hope the internet works. So actually the system allows in real time to vision the units, and we have approximately 20,000 refrigerators and freezers across the world which are connected in real time to the system. Of course you will need an internet connection to be able to vision the details of the product, and I think Giselle is trying to reconnect to the system. And here we go. So here you can see typically a unit that has been installed and that is now being traced, and you can see it's exactly the same unit as you see out here on the podium on the left hand side. And you can see on the top graph that is the internal temperature of that refrigerator at this point of time. On the left side you can see that the arrow is in the green side, so that means that the unit is perfectly within the range that has been requested by WHO. On the bottom left side you can see that the door is closed at this point of time, and also that there is energy charging the battery for the monitoring system. On the bottom center, you can see the temperature day and night, so you can see the differences in temperature day and night. And on the right hand side bottom, you can see also the GPS localization where the unit is exactly. So if you go on Google Maps and then you go to the satellite view, you can see if it is a village, a mountain area, or wherever the unit may be in operations, and it really gives you real-time information about your unit. And this is extremely, extremely important also for the COVID vaccines, because if you think that in one single refrigerator you will have a value above several million euros in one single refrigerator, it is of course hugely important that you have quality products to store and transport these vaccines of extremely high value, not only monetary, but also for the immunization of the population, to make sure that the people are immunized with vaccines that are potent, and not that they have lost their potency somewhere in the cold chain. Thank you.
Thank you, Luke. So first of all, before I give updates on where we are, I'm really proud here as an Indian to be part of this initiative. When I joined the company 5 years ago, I told Luke that I'm fascinated by what you do, by the mission to save lives using reliable and innovative technology, but that I was deeply disappointed that the company had a negligible presence in India. And I told him that it was my dream to also ensure that this company is present in a meaningful way in India. And today, it's beyond my wildest dreams what has happened in the last month, thanks to the visionary approach shown by the two Prime Ministers, Sri Narendra Modi and Prime Minister Patel of Luxembourg. So for me, this is honestly a moment of great pride, great happiness that we will be here in India making the highest technology, the best, the most innovative products in India to save lives. Now, getting to specifics, we have spent, as Luke mentioned, the last 2 weeks roaming and visiting many parts of the country. We have received incredible support from the central government, from the state governments, from pharmaceutical companies, from essentially everyone that we met. And we have made a decision that we will establish our manufacturing facility in the Mundra SEZ, which is at the port. We have chosen this location after looking at several locations in Telangana, in Maharashtra, and also in Gujarat. And the reason why we have done this is for a few reasons. The first one, of course, is the infrastructure and the quality of the infrastructure that we saw there. Proximity to our supplier base, which is very important for us. And access to the port, which is critical for ensuring rapid production, because the need of the hour is to be present in as short a time frame and to have products ready to store and transport vaccines to far-flung corners of the country. We are extremely grateful to the support shown by the Gujarat government as well as the Honorable Chief Minister Sri Rupani. I would like to extend our gratitude to him and the entire government. We have also a strong conviction that this location will be a fantastic export hub for us. We believe this location will enable exports to Southeast Asia and also to East Africa. And so this will be a location made in India, not just for India, but also for the world. We are looking at an investment of about 15 million euros in the first phase. This has already been approved. We already have lined up the funds. And we will be looking at employing close to 100 people directly in our first phase. No doubt it will generate a lot more employment indirectly as well. Also gives me great pride to announce our first launch event in Ahmedabad on the 1st of January 2021. So no better way to start the new year than with a pledge to fight COVID and get rid of it as soon as possible. I'm also very pleased at the support we've received from pharmaceutical companies around the country. We've met with some of the leading pharmaceutical companies. In fact, we already have signed an MOU with Dr. Reddy's for supplying and transporting the vaccine, not just across the country, but also exporting and really realizing the ambition of making India not just the vaccine capital of the world, but also the vaccine cold chain capital of the world. And I'm sure that there's a lot more coming on that. Within 2 weeks, we've also already recruited our first 2 employees. We have our head of India Sales and Product Management, Somnath Rampal, and I'm pleased that he's here with us. Welcome, Som. We're also very pleased that we have our purchasing manager, Vishal, who is Vishal Bimpuria, who is based in Ahmedabad. And this is extremely critical for us because we have a vision to have at least a local content of 80% from the beginning. And the idea is also to be 100% made in India without using any Chinese components. Finally, as an interim solution, and in order to meet the immediate requirements of the country, we have decided to tie up with an extremely reputed local company which is called Parekh Integrated Services Private Limited. We will work jointly hand in hand with them to make our first Made in India product roll out in February 2021. We have decided to work with Parekh because they share the same values of integrity, reliability and innovation, which they have demonstrated while working with all the leading multinational pharmaceutical companies of the world. But I will also hand it over now to Nimish Parekh, who is a director of Parekh Integrated, and he'll talk a little bit more about Parekh Integrated.
Thank you, Jaisal, and thank you, Luke. We are very proud of this partnership and also the confidence you have shown in our organization. It's been a long last 10 days where we've been spending a lot of time with the entire senior management from Luxembourg and trying to draw up the plans. So it's been very interesting, and also they've done all their detailed due diligence plus all the audits, and we're very proud to say that they already came back and gave us feedback stating that some of our facilities were meeting their standards and also going beyond. So thank you once again, and we are also proud to be a part of this Make in India project, and also being humbled as an organization to provide this cold chain solution along with B Medical for the country. Also one thing, we hope B Medical can expand the network because we are spread across the country, and those solutions would help in reaching these boxes to all the parts. So that's where the logistics comes in, and we hope we can add value to this entire supply chain for you. Thank you so much.
Well, thank you. This is in many ways enlightening to us, what you have brought as a product here. But I'll ask you some very simple things. And I was trying to figure it out while you guys were talking. A lot of it was quite technical or maybe business information. But for the average person, for the layman, how are you going to start? Are you going to start manufacturing these boxes right here in India? And are you going to do that with his company? Is that what it is?
Yes.
Can we make another microphone work, please?
So actually the intention is to have a quick start in phase 1. And so what we will do is the blue parts that you see here in front of you are rotomolded, robotic rotomolding technology. And this technology allows to produce in very large quantities in Luxembourg. So the intention is really to rotomold the blue parts, and that would be the only component that we still have to bring from Luxembourg in phase 1. And then all the other assembly line, the components, the compressor, the evaporator, the condenser, the electronics, all of that will come from India and will be mounted in India with the team of Barrick. And so this is in phase 1, and then while we are providing products, finished products made in India of 80%, that we will start in the second phase also of building our factory, where including the rotomolding will also be done in India.
Okay. So what I'm, can you arrange for another microphone, Sanjay? It should work. What I'm trying to understand is that phase 1 you'll bring the outer shell, right? But the electronics and the compressor and everything will be made in India with Barrick, right?
Correct.
So Barrick is your joint venture partner. Is that what it is? Is it a joint venture or is it a pure investment or what is it? You can speak into that mic. This one works.
Well, I think of Barrick more as a partner for us, whether you call it joint venture or something else. I think we are really working hand in hand because the need of the hour is to have this as soon as available as soon as possible. So I think of Nimish more as a brother than really a business associate. Our idea as B Medical is we will retain our identity. We are a company made in Luxembourg and we will retain that identity. So the idea, of course, is not to lose our identity in any way, and I think as a company coming in from Luxembourg, that's very important for us.
Mm-hmm. I'll just use this. Yeah. These guys have to stop using such contraptions. So that's good you explained this to us, but India is today known for its science, technology, innovation, R&D. Are you saying that we are completely now up to speed with actually making everything that you called very high tech in Luxembourg right now in India? I would ask Nimish to pitch in.
So what we're going to do is we're going to partner with them and try and put this entire solution together with their know-how, their expertise, who will be guiding us, and then we will be trying to roll out each one of these solutions of different multiple variants that you see in front of us today, along with the different projections that they have. So we will be handling and be the ground partner, and that's going to be our main focus and rollout to try and also scale in times to come.
Yeah. So am I getting it wrong? You're a logistics partner or you're also a manufacturing partner or both?
But they will be a partner for both. And to perhaps answer your question a bit in detail, I think India certainly possesses the technologies, and to be honest, we have been impressed by what we have seen. In fact, just at Barrick's facility, there were already 5 or 6 ideas that we said we would copy and take back to Luxembourg, of course with this permission. But I think what is unique about us is the amalgamation of different technologies to make a product that is extremely robust and suited for storing vaccines in the harshest and remotest locations in the world. Because at the end of the day, you could take an approach and say, yes, but this is a fridge at the end of the day. But I think it's not a fridge because it stores millions of dollars of vaccines, and you need to ensure that it's at the right temperature all the time.
And the right temperature all the time is what makes the vaccine actually work. Because if it's not at the right temperature all the time, then immaterial of whether you're shooting 1 or 2 doses won't work at all, right?
Well, then you're just injecting water.
Yeah, so that's critical to understand. Do you want to tell us what these things cost? I mean, everybody's going to ask you that question. I mean, you said it stores millions of dollars of vaccine, so it must be worth a lot of money.
Well, surprisingly not when you consider the value of the vaccines. And just as an example, if I take the value of Pfizer's vaccines, even if I take a conservative approach of $10 a vaccine, this box right in front of me can store about 5,000 doses
of that vaccine, right? So straight away you're talking about $50,000 of vaccine, and this box, just to compare it with dollars, for $50,000 of vaccine, this box will cost you $400.
So this box costs $400? No.
Yes, and
The whole box?
yes,
The way it works?
the way it works, $400, and that's the price you pay for a box which can store a Pfizer vaccine at minus 70 degrees Celsius.
Are you sure this is only $400? That means 28,000 rupees for the whole box?
Yes, indeed.
That's incredible.
Yes, but and that's I think the tragedy as well, because a box like this you should definitely not compromise. And so I think one of the challenges for me, which I find particularly with India, is the mindset of buying the cheapest product. Whereas for something like this, you should look at the lowest total cost of ownership. As an example, this box works for 10 years. And for 10 years, if you're storing, let's assume, millions of dollars of vaccines every year, over 10 years, just one time the box breaks down, you've lost several $100,000. So I think you need to buy the right
No, but
equipment.
you don't need to convince me. I mean, 28,000 rupees, you can't even buy a refrigerator, the normal refrigerator.
Exactly.
So this is incredible. This is going to store the vaccine that will save people's life for just 28,000 rupees. I must applaud you on this. This is incredible. Incredible. So you saying the first box, the first rollout in India will be in February, and you said, look, it will be 1 month before the deadline that was given to you.
Yes, exactly. The deadline that was given to us was March, and actually before starting our trip here in India, it was a true headache because we had no clue how to achieve that deadline, and we knew that we were fighting against time, and not only against COVID. And actually, when we met Parek, and Parek was actually using our equipment as a customer, we were very, very surprised to see the quality of that company and its people and the work that they were providing already for existing customers that also we share with them. And I think that really gave us a lot of hope to be able to succeed, to achieve that deadline of March, and even to improve it by being ready in February. So it was really a very positive surprise, and luckily the first week that we were traveling, that we had this positive surprise.
So so Parikh has been using B Medical Systems other equipment or the same equipment?
So we've been using this box, the one that Jezza spoke about, and also the refrigerators, the ultra cold ones which are at minus 70 degrees and at minus 40 degrees. So for different products that we currently provide logistic solutions for various, as Luke was saying, various pharmaceutical companies which require these solutions, where we've been using them for up to 96 hours in India, currently transporting goods and storing goods for many times. So that's existingly a B Medical example and a live example that you can see.
So this is not something that came out of the blue. It's been around, right? In India, you've had it.
We've had it for over 6 months, and that's a proof testament.
So this is something that you were pitching in because of COVID, or you were doing it for other reasons anyway?
We were doing it for other reasons, and then as the partnership with Jezza and the team grew, so we thought might as well talk about what else can we add, because we know the challenges in India as been highlighted. How do you store it and how do you transport it? So hopefully we can add some value in that too.
So you would store, transport, send it to the location, and then it would be kept there till the vaccine is used, right? Right?
Potentially.
Yeah, that's what it's going to be, right?
Absolutely. The unique thing about this box is it can go by air, it can go by train, it can go by road, it can go on horseback, and it can go when it's snowing outside at 0 degrees. You can transport it when it's the middle of the summer at 45 degrees. And it works perfectly across all conditions.
One last question, because I know I'm a man of technology myself, so I get a little, detailed. So inside this box is perfect slots made for storing those rapsules or capsules or vials, whatever those vaccines come in, right? So it's made for that.
Yes, actually, that's exactly right. And what Giselle was saying is that the same box can be used for the different temperature profiles. So when a government invests in such equipment, they can use it today for COVID vaccine, but maybe tomorrow for malaria or for polio. And so it's a long-term investment which really values also the content. And it's not only in the boxes, but also in the freezer that we were mentioning, the -70 freezer here. That's also, again, the cheapest insurance policy that a government can buy, because by buying such equipment, they can use it at -70 for the Pfizer vaccine, but the same equipment, they can use it, for example, at -20 for a Moderna vaccine or the Sputnik vaccine, and there is no other equipment in the world that can do that. And that's why the technology is so revolutionary and really very, how should I say, a really strong answer to the concerns that the governments have around the world.
So so you can modulate the temperature and settings is what you're saying. The electronics will allow you to set it up for different products.
Exactly, but the same unit, and that is very challenging. It sounds very simple as you put it, but technically it's very complex because
You got to make it simple for the people who are listening to this, because average person needs to understand what is so unique, what is so beautiful, what is so cost effective, and how does it deliver what they are looking forward to so much. But that's great. Do you want to add anything before we ask if somebody has any questions? Can you pass the microphone there, please? Do you want to say anything else before we go to questions or not?
Let's go for the questions.
Hi, I'm basically a civil engineer, but into kitchen specialization. I work with Electrolux for fridges and ovens. Now I have 3 questions. One is, are you making it a portable version for transporting it, maybe in a handy version? Are you looking at that? Secondly, would you be having a self-sterilizing facility within the box? Thirdly, would you be having a partition within the box for different temperature zones? If somebody would want the same for different vaccines at different temperatures, would it be possible?
So I think to respond to your first question, yes, we have smaller boxes. It starts from half a liter to 20 liters, and so the half-liter box, of course, is extremely portable, and you can carry 5 of them yourself. These boxes are not self-sterilizing, and the third one on splitting them up into different compartments, that's not possible, but also not recommended, because what happens then is if the healthcare worker makes a mistake,
You're mixing vaccines.
you could inject something which can have a pretty adverse consequence.
Anybody else with questions? You can ask in Spanish too, my friend. Mr. Border, any questions? Alfredo, give the microphone. Yeah, it's working.
¿Es posible que estos equipos sean traídos a algunos países de América Latina?
Sí, por supuesto, estos equipamientos ya están en diferentes países de América Latina. Hay equipamientos en Colombia, México, Perú, Chile, Guatemala, Nicaragua. Ya hay muchos de esos equipamientos ya en los países porque estamos el líder mundial en todos los continentes hace más de 40 años.
Muchas gracias.
Anil, do you see any questions online? Do you see anything online? No, okay. You talked about exports, whenever. I'm not saying this is going to happen. First of all, you're tackling the situation in India, which is humongous. But when do you expect this full steam going ahead, and how would you factor in exports from where first? I mean, Africa and Southeast Asia is a lot of big market.
No, indeed, and actually it will take us time to set up a full-blown operation here in India, and we're estimating between 9 and 12 months to have it fully operational. But I think also the challenge of COVID vaccination only in India is not a small challenge. And I think we will be occupied only with the Indian market at least until end of 2022. If we are looking at the availability of vaccines, the quantity of vaccines that are available, but also the equipment that will be available. And in terms of exportation, we will be, of course, looking at Southeast Asia, but also at Eastern Africa, which is already a continent which we are serving extremely heavily from Luxembourg, and it would be a lot more efficient to do that as of India, of the new base that we are going to implement now.
So is it going to be cheaper to make this in India? than importing it from Luxembourg?
Yes, it will be. It will be cheaper, of course, because there is also labor which is included in this. But we also want to bring state-of-the-art technology in manufacturing. And so in terms of automation, there will be a high degree of automation also that will be foreseen. And that is not only for the production capacity, but it is also for the, I would say, the precision of the different components fitting together and really have a top-notch product in terms of final quality. Because every single unit that you see here has been tested for minimum 12 hours in the factory. It is not only aesthetically a good-looking product, it's also a well-functioning product before it leaves our factory. And we want to impose the same quality levels here in India as we do in our factory in Luxembourg.
But look, like every good thing that came to India over decades, everything in terms of technology, even automobiles. So you start with the assembly kit, So you're going to assemble this first, right? With bits and pieces as you ramp up all of the various parts of manufacturing, especially this, robotic, molding, right?
Yes, that's correct. So it's really going to be an increase in terms of components coming in, made from India, in India. And so, yes, we really have to look at the quality level because, again, the vaccines that are in there are life-saving vaccines, and it's really important to protect it from the beginning all the way to the end. In cold chain, there's a saying which says, the cold chain is only as strong as the weakest link in the cold chain, and it starts with the products.
So you talked about investing 15 million euros, right? 15 million euros. So what translated that into Indian rupees becomes
about 140 crores.
So 140 crores approximately,
Yeah.
And that's enough to start phase 1, or is that the total investment?
No, that's phase 1. We will be looking at a much larger investment over the second phase as we bring in robotic proto-molding as Luke mentioned. So I think that's the capital we have already earmarked for this.
For now.
For now.
And by February, how many of these boxes, what is your expected capacity?
Well, I think the challenge is we cannot produce enough of them because when we talk to several governments talk to us not in hundreds or thousands but in tens of thousands. And so
but starting February, you'll have 10,000 of these or 20,000 of these, or how many?
Well, our aim is to start in the thousands on a weekly basis. So that's our target.
Thousands. I mean, you're still leaving it sort of open. 5,000. To give us some number, we in the news business like to have numbers. Go away. We want some numbers. 10,000, 5,000, something.
Well, I would say we are...
On a monthly basis, let us say in month of February, first time when you deliver, you'll be delivering 10,000 in month of February?
No, I would say on a monthly basis, we would be looking at about 5,000.
5,000.
Yeah. And of course we can then ramp up
So 5,000 times 5,000 doses inside. So you could, so that we are looking at what? That's the number of doses we could carry. Right?
With this product, that's right. But the good thing about the roto-molding technology is that it is extremely scalable. So we can expand very rapidly. And when you combine that with the fact that adding an assembly line in India is extremely scalable as well. Because at the end of the day, it is about adding more people, which India has, quite frankly, an abundance of skilled manpower. So I think it's also a marriage between the best of what Luxembourg has to offer versus and also the best of India. And therefore, I have a lot of hope that although we start with 5,000 boxes, we can very quickly ramp it up by a factor of 5-6 times in a couple of months.
Okay, that's good. Well, unless you want to add anybody else for any questions, any... Sudhir, Ashokji, satisfied? You got all the information? Well, thank you gentlemen. Thank you very much for making it here. We know we did this in a big hurry. You told us yesterday that you'd like to actually get this information out. So I want to thank all, particularly the media friends that we have here and from all the 4 major networks and channels. And all the other journalists, and thank you for choosing the Foreign Correspondents Club of South Asia. And this is great news for the country, great news for humanity, and I think good relationship between the 2 countries. So let's step up to the plate and let's deliver all we can to save India. Thank you very much and good night.
Thank you.
Thank you.